Hi guys, we are going to discuss about the natural history of the disease. This can be asked as a essay question in the university examinations. So the competency 1.4, that is describe and discuss the natural history of the disease. How can the university examiners can ask this question is describe the natural history of the disease with suitable examples, and in section B they ask that explain the levels of prevention based on natural history of disease and the modes of intervention to prevent that disease. So learn about the natural history of disease. So first of all, what is disease? Disease is a condition, right? Disease is a condition that impairs the normal functioning of the body or mind, right? So disease is a complex interaction between the agent and the host to that of the environment. We have learned this in the concept of causation, right? The epidemiological triad. See, if you see this environment, in the environment already the agent is present. If the agent infects the host, so this complex interaction of agent host to that of the environment is the cause of disease, right? So the definition of the natural history of the disease, the name itself tells natural history of the disease. I will make you understand with an example. So if a person has got a disease, okay, an infectious disease, suppose an infectious disease like tuberculosis, you suppose. So from the entry of the infectious agent into the host and its incubation and development of the clinical manifestation, that is symptoms and signs, so that course of that process of disease evolution in that person is a natural history of the disease. And the one thing to be noted is we are not at all involved in the treatment, we are not at all intervening that disease, so we just left that. So the natural evolution process of the disease in that individual is the natural history of the disease, that is from the entry of the infectious agent to the incubation to the development of the signs and symptoms and the outcome, which may be recovery, death or disability. So the definition of the natural history of the disease is a concept. It is a concept that signifies the way in which a disease evolves. So the disease evolves over time from the earliest stage of its pre-pathogenesis phase. From its pre-pathogenesis phase to that of the pathogenesis phase and to its termination as a recovery, that is the person may be healed or the person may be left with disability or the person may die in the absence of the treatment or prevention. That evolution of the disease is the natural history of the disease, right? I hope you understood. So we'll learn this, we'll understand this natural history of disease with the help of an example, that is tuberculosis. The natural history and spectrum of tuberculosis, it is an infectious disease, right? So see, on the x-axis is the time, on the y-axis it is the increasing immunity. So the primary infection, this is the primary infection. So after the primary infection, after the infectious agent infecting in a host, it incubates and it localizes, right? Localized caseation, the primary complex. See the caseation, we can see in the lung parenchyma, caseation in the lymph node. So this primary complex may disseminate and leads to progressive primary TB, that is massive hematogenesis dissemination to the organs like liver, spleen. This is called as miliary TB, right? And this primary complex that is formed in the lung parenchyma can also be healed, that is healed lesion, organism not viable, it is dormant. So there can be scars on the parenchyma, and also this primary complex can also lead to latent infections, that is the organism is dormant, inactive. So this can be pulmonary or extrapulmonary. If it is extrapulmonary, it reactivates and forms into or converts into secondary tuberculosis, that is reinfection in later part of life after months or years most probably. So this secondary tuberculosis is extremely dangerous, right? It can progressive to secondary TB with massive hematogenesis dissemination and can form into miliary TB, which is life threatening condition. And also it can form localized caseating destructive lesions, scar formation, granuloma formation. It can become destructive lesions in the lung parenchyma, or it can also disseminate into surrounding organs like liver or kidney. So where it also forms caseating necrosis, granuloma formation. So this overall process of the disease, right? This overall process of the disease, infectious agent that is being evolved, that is being making this process in the host, is the natural history of the disease. In this, we didn't intervene, like we didn't intervene in this disease process, like we didn't introduce the treatment process. Treatment therapy we didn't introduce, right? If we introduced treatment therapy or therapy, chemotherapy, so this process may be changed, right? The disease process will not progress into secondary TB. Will here itself it will compromise, or the person may be healed or treated, right? So without the intervention of the treatment, modes of interventions or levels of preventions, the process of the disease is the natural history of the disease. I hope you understand. See, same example, you see the pathophysiology of the pulmonary tuberculosis. So the high risk, these are high risk individuals, that is host, old age infants, children, low socioeconomic status, drug addicts, HIV positive patients, severely malnourished healthcare workers. So etiological agent, you can see the agent, that is Mycobacterium tuberculosis, the mode of transmission is droplet nuclei, and environment. See the epidemiological triad, the cause, the concept of causation, high risk communities, low income communities, healthcare facilities. So this interaction lead to entry of the infectious agent through respiratory tract or alveoli and reach to alveoli. The procedure where, but the signs and symptoms, because the clinical manifestations, these are the clinical manifestations, right? So like fever, fatigue, anorexia, hemoptysis, productive cough, night sweats, parallel chest pain, dyspnea, anxiety, low self-esteem, elevated WBC. So these signs and symptoms are developed by the infectious agent, right? After the infection, after infecting into the host. So this is after the signs and symptoms, the outcome, the final outcome, that is the termination of the disease, either may be death, either may be the death of the person, or it can be with the introduction of the treatment, it can be cure, or it can be disability. So this process is a natural history of the disease. The natural history of the disease is a key concept in epidemiology. It is a key concept in epidemiology because of this process of evolution of the disease in a host, we can get to know about the nature of the disease, nature of the infectious agent, right? So that we can intervene in the disease process to cure that disease or to prevent that disease. The natural history of disease is best established, is best studied with the cause studies, or also called as longitudinal studies, but these studies are expensive, so that the alternative means are cross-sectional studies and retrospective studies. So these are reliable, we can afford. Each disease has its own unique natural history, not same in all individuals. So that's why